It's time again for another edition of Sports Insider, brought to you by Faith Regional Health Services. I'm News Channel Nebraska's Chris Whitney, and joining me today is Russ Baumert, physical therapist with Faith Regional Rehabilitation Therapies. Thank you so much for joining us, Russ.
Thanks for having me.
Let's talk about ACL injuries just a little bit. There are differences in ACL injuries. What are the ways in which an athlete, or anybody else for that matter, can rupture their ACL?
Well, we basically categorize ACL injuries into two categories. We have contact injuries and non-contact injuries. Your contact injury is when you get run into, rolled over, stepped on, as a result of an external force. The non-contact injury is usually a result of cutting or jumping. You see this often where someone is running, they plant their leg goes one way, and their body goes the other. Everyone kind of winces. They see that happening. You also see that when we jump and the knee kind of buckles in.
Is there one type that's maybe a little bit more common than the other one in terms of ACL injuries?
They're kind of sports specific as far as the rates of the two categories. Basketball injuries, non-contact injuries are more common. When you get to more contact sports such as soccer and football, it starts to turn the tide where you have more contact type injuries.
Now, this is, of course, a very serious injury, at least it can be for athletes, certainly. Is there anything athletes can do to help prevent some of these ACL injuries?
Well, we can never eliminate the risk of an ACL injury. However, we can reduce it substantially. For non-contact injuries, the literature has shown that doing balance training, jump training, and specifically looking at some of the muscles in the hip can try to control that leg when it hits the ground so that it doesn't buckle or collapse on a person.
Absolutely. Now, if somebody's interested in finding out maybe a little bit more information on this, I understand you've got a sports metrics program. Can you talk to us a little bit more about that?
Yes, the athletic trainers at our hospital during the summertime run programs in the schools. It's known as sports metrics. It's a jumping program. It's meant to teach balance and strength and coordination. It's mostly geared towards females, as non-contact injuries, ACL injuries, are more common in the female population.
Absolutely, and again, you said this is kind of a 6-week program that is designed to address those issues. If anybody has any more information, who else can they contact?
Well, they can contact our department at Faith Regional Rehab Services.
Absolutely. Sounds good. Thank you so much for joining us. Russ Baumert, physical therapist with Faith Regional Rehabilitation Therapies. Thanks, Russ.
Thanks for having me.
This has been another edition of Sports Insider, brought to you by Faith Regional Health Services.